Arbidol capsules are an antiviral agent. It has a moderate immunomodulatory effect, increases the body's resistance to viral infections. Therapeutic efficacy in viral infections is manifested in a decrease in the duration and severity of the course of the disease and its main symptoms, as well as in a decrease in the incidence of complications associated with a viral infection and exacerbations of chronic bacterial diseases. Indications: prevention and treatment in adults and children, influenza A and B, other SARS, complex therapy of recurrent hepatic infection, prevention of postoperative infectious complications, complex therapy of acute intestinal infections of rotavirus etiology in children older than 6 years. How to use: Arbidol taken orally before meals, single dose, children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg, 2 capsules of 100 mg or 4 capsules of 50 mg. For non-specific prophylaxis: in direct contact with patients with influenza and other acute respiratory viral infections, children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg once a day, for 10 to 14 days. During the epidemic of influenza and other acute respiratory viral infections, to prevent exacerbations of chronic bronchitis, recurrence of herpes infection, children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg twice a week for 3 weeks. For the prevention of SARS in contact with the patient, adults and children over 12 years of age are prescribed 200 mg once a day, children from 6 to 12 years old, 100 mg once a day, before meals for 12 to 14 days. Prevention of postoperative complications: children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg 2 times before surgery, then on days 2 and 5 after surgery. For treatment influenza and other SARS without complications, children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg 4 times a day, every 6 hours for 5 days. Influenza, other acute respiratory viral infections with the development of complications, bronchitis, pneumonia, etc. Children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg 4 times a day, every 6 hours for 5 days. Then a single dose 1 time per week within 4 weeks. Severe acute respiratory syndrome: children over 12 years old and adults, 200 mg 2 times a day for 8 to 10 days. In the complex treatment of chronic bronchitis, hepatic infection, children from 3 to 6 years old, 50 mg, from 6 to 12 years old, 100 mg, over 12 years old and adults, 200 mg 4 times a day, every 6 hours for 5 to 7 days, then a single dose 2 times a day for 4 weeks. Complex therapy of acute intestinal infections of rotavirus etiology in children older than 3 years, from 3 to 6 years, 50 mg, from 6 to 12 years, 100 mg, over 12 years, 200 mg 4 times a day, every 6 hours for 5 days. Contraindications: hypersensitivity to methanol or any component of the drug, children aged up to 6 years, first trimester of pregnancy, breastfeeding period, carefully second and third trimester of pregnancy. Precautions: it is necessary to follow the schema recommended in the instructions and the duration of taking the drug. In case of missing 1 dose of the drug, the missing dose should be taken as soon as possible, and the course of taking the drug should be continued according to the started scheme. If after using the drug Arbidol for 3 days in the treatment of influenza and other acute respiratory viral infections, the severity of the symptoms of the disease, including high temperature, persists, then it should consult a doctor to assess the validity of taking the drug. Side effects: the drug Arbidol belongs to low toxic drugs and is usually well tolerated. Side effects are rare, usually mild or moderate and transient. Immune system disorders: rarely. Allergic reactions: if any of the side effects listed in the instructions get worse, or if you notice any other side effects not listed in the instructions, tell a doctor.